delegating to a CNA or another nurse is something that you have to do. Delegation should always be done in coordination with what the person you are delegating to can do. You're not going to tell a CNA to draw your labs. Unless for whatever reason your state allows for CNAs to draw labs, my state does not, you are not going to do that. I'm not going to call a CNA and say, hey, pass out my medication. I can't do that. But at the same time, you need to be respectful when you are delegating something. If you're sitting at the nurse's desk and you have nothing going on, and you can tell that that CNA is swamped and somebody calls out and asks for a blanket, maybe I'm going to get up and give you a blanket. You know, maybe I don't have anything going on right this second. I can get you a blanket. I probably won't delegate that out. However, on the other hand, if I've medicated 2 patients, I got 3 more to medicate, 2 assessments, somebody's got a catheter that's about overflowed, somebody's running on blood, you better bet, CNA, I'm going to delegate everything to you that I can. You better bet that. So, I mean, if you're buried, delegate. If you're not buried and they are buried, maybe it's not time to delegate. And also, if you're like a charge nurse or a lead nurse, whatever y'all call it, be mindful of what you delegate to who in that aspect also. You may need to delegate to an LPN. Be mindful of what that LPN can do and cannot do. And, you know, there are certain medications or certain routes that the medications can go in. I know, for instance, a portacath in North Carolina, portacaths are kind of an iffy subject. Please take note, if your patient has a portacath and you're delegating that to an LPN, be mindful that that LPN may or may not be able to give that medication through the portacath. So delegate properly and delegate respectfully. Delegate in a manner that you would like to be talked to. Don't yell at your CNAs. Don't talk down to your CNAs. I understand if you're really busy and you see them sitting at the nurse's office and you asked them to get you vitals 15 minutes ago and it's still not done, I know you're going to get upset. I've been there. I've done that. It happens. It gets the best of us and the worst of us. So if you're delegated something, to be mindful of that. Be mindful that the person that just told you to or asked you to do something may be swamped. They may be drowning and need some air. You know, help that person out. Don't just blow them off. Don't just tell them, you know, I'll do it and you don't do it. Those are things that I don't really like. So, you know, be respectful, be mindful, and always properly delegate. You know, like I said, you don't want a CNA drawing your labs. It's illegal. And if you delegate it and the CNA says, oh, well, you know, Nurse Chris over there, he told me you draw them labs up, so I drawed them up. You're probably going to get in a little bit of trouble over that. So know your state laws, know what you can do, know what someone else can do, and just delegate accordingly, you know. And if it's done in a respectful manner, I believe everything's going to get done. You're going to have some people, you know, it happens everywhere. Maybe they don't hear you right. Maybe you don't explain it the way you want it done. Things just don't happen sometimes. That happens. And it may or may not be someone's fault. You know, don't just go screaming at somebody when that happens. But I hope it helps. Thank you much.